One of the questions that we get is when someone has a tear in a muscle or a tendon or a ligament, why does therapy help? In the old days, they used to cast someone's leg after surgery, and then it took months and months of rehab to try to get that leg to move again, because everything just scars up with short, not good scars. So when you have good, healthy fibers, they line up like that, whether it's muscle, tendon, ligament fibers. When you have a tear in those fibers and you get this jagged tear and something tears it apart, all right, we want this to heal. If you do nothing, you're going to get a short, tight scar, but you're most likely going to heal. But what's going to happen is this scar, this tear, is going to kind of get this short, not clean scar. So it's going to have less function. You're going to have less range of motion. When you heal with mobility and traction and manipulation, you're still going to have a scar in here, but it's going to be longer, cleaner, and straighter and more functional. That's the whole reason doing the therapy and the movements and all the things that we do in physical therapy, chiropractic, and manipulation. Also, by doing those things, we increase circulation, which also helps it heal faster. And healing is all about circulation. That's why muscles heal faster, then tendons, then ligament, and then cartilage. All in that order have muscle having the most blood circulation, cartilage having the least. So that's why certain injuries take much longer to heal, based on the degree and the type of tissue that's damaged. Now, manipulation and chiropractic manipulation and physical therapy, occupational therapy, work so well together because you have this range of motion, okay? This would be your full range of motion. That would be like moving your finger like this and then pushing it a little further and having assisted range of motion, and then where you actually push it and hear a click and you're having cavitation of the joint. So when you have an injury, the different degrees of range of motion might be your active range of motion might be here, and then you might get passive to here, but then cavitation, when you bring it through its full range of motion, is here. So if you just let it heal and do nothing, you're going to have a very short range of motion. If you have therapy and stretching, you're going to increase that range of motion. And if you bring it that little degree more where you have that joint cavitation where people hear that pop noise, that's when you can increase, that's when you're going to get a full range of motion. If you suffer from any of these type of injuries, whether it's muscular, tendinous, ligamentous, or cartilage, reach out to us at Denville Medical Associates and we'll review your problem, we'll review the situation, and we'll let you know how close or how far we could get you to 100% of your full function. And that's the whole idea. What we do here is try to return you to 100% function or as close as possible.